The round hit you in the thigh. You felt it before you heard it, like someone drove a railroad spike through your leg with a sledgehammer. Now there's a hole the size of a quarter, pumping blood onto the linoleum, and your phone's got no signal because the cell towers went dark 3 days ago. You're alone. The streets outside sound like a war zone, and you've got about 4 minutes before you pass out from blood loss, and maybe 10 before you're looking at permanent dirt nap territory. No paramedics, no ER, no helpful nurse to hold your hand. Just you, whatever's in your kitchen junk drawer, and a choice. You can lie down and let the universe win, or you can get angry enough to live. Let's get angry. Step 1. Find the leak and shut it down like you're fixing a burst pipe. Your body holds about 5 liters of blood. Lose 2 and you're in serious trouble. Lose 3 and you're having a conversation with your dead grandmother. Right now you're hemorrhaging, and every second counts. First thing, expose the wound. Rip the pants off if you have to. You need to see what you're dealing with. Is it spurting in rhythmic jets? That's arterial. That's the bad one. Is it flowing steady and dark? That's venous. Still bad, but you've got more time. For arterial bleeding, forget gentle pressure. You need to find the artery upstream and compress it hard against the bone. For a thigh wound, jam your fist into the crease where your leg meets your groin. That's your femoral artery. Press down like you're trying to leave a dent in the floor beneath you. You're manually shutting off the pipeline. Now grab anything absorbent, a towel, a shirt, that fancy decorative throw blanket you never actually used. Wad it up thick and press it onto the wound with both hands if you can spare them. You're building a dam. The fabric soaks up blood and gives your platelet something to grip onto. Don't lift it to peak. Every time you do, you wash away the clot that's trying to form. If blood soaks through, stack another layer on top. You're building layers like some kind of horrible lasagna. Keep that pressure constant for at least 20 minutes.
Step 2. The tourniquet. When to use the last resort. If direct pressure stops the bleeding within 3 minutes, skip the tourniquet. If blood is still pumping out like a broken fountain after 3 minutes of hard pressure, it's tourniquet time. Find something wide and strong. A belt is perfect, a ripped towel twisted tight works. Width matters, because narrow things cut through muscle like piano wire. You want at least 1.5 inches wide. Wrap it around the limb between the wound and the heart. For a thigh wound, that means high up near the groin. Tight as you can get it, then tighter. Find something rigid, a wooden spoon, a metal rod, and use it as a windlass. Thread it under the tourniquet and twist. Keep twisting until the bleeding stops completely. Not slows, stops. It's gonna hurt worse than the bullet. That's normal. Pain means there's still tissue alive to complain. Now write down the time. Use a marker on your skin. Use blood on the wall. A tourniquet can stay on for up to 2 hours without permanent damage. After that, you're in tissue death territory. You've just started a countdown timer. Step 3. Deal with the hole itself, because leaving it open is asking for infection. Once bleeding is controlled, you need to think about what's inside that wound. Bullets don't travel alone. They bring fabric from your pants, dirt from the street, bacteria, debris. If you've got running water, use it. Tap water is infinitely better than doing nothing. Flood the wound, not a gentle rinse, a stream, high pressure if you can manage it. Pour at least 1/2 liter through that wound. If you got any kind of antiseptic, now's the time. Rubbing alcohol, hydrogen peroxide, iodine, even mouthwash in a pinch. Pour it in. The wound will foam, it'll burn, you might scream. All normal. Once it's as clean as you can get it, you need to pack it. Use clean cloth strips, gauze if you have it, even tampons work. They're literally designed to absorb blood and expand. Push the material into the wound cavity gently but firmly. You're filling empty space and maintaining pressure from the inside. Cover everything with the cleanest dressing you have. Tape it down with medical tape, duct tape, even packing tape. You need a seal to keep new contaminants out. Step 4. Antibiotics are the difference between next week and never. Sepsis kills more gunshot victims than blood loss. If you have antibiotics in your medicine cabinet, start them now. Amoxicillin, cephalexin, doxycycline, anything broad spectrum. Follow the bottle directions. Take the full course even if you feel fine. No antibiotics? Raw garlic is legitimately antimicrobial. Crush 3 cloves, let them sit for 10 minutes to activate the allicin, then eat them. Yes, raw, yes, it's disgusting. Do it 3 times a day. Honey, real honey, can be applied directly to the wound under the dressing. It's hygroscopic, meaning it pulls moisture out of bacterial cells and kills them. Oregano oil, a few drops in water taken internally, has antimicrobial properties. You're building a makeshift antibiotic cocktail from your kitchen. It's not as good as real medicine, but it's infinitely better than nothing.
Step 5. Manage pain without losing your mind. You don't want to eliminate pain completely. You want to take the edge off so you can think. Ibuprofen reduces inflammation and pain. Take 600 milligrams every 6 hours. Acetaminophen handles different pain pathways. Take 1,000 milligrams every 6 hours. You can take both. They work differently. If you've got nothing, ice works. Cold constricts blood vessels and numbs nerve endings. Wrap it in cloth and apply it for 20 minutes every hour. Elevation helps too. Keep the wounded limb above heart level. It reduces swelling and throbbing. Step 6. Watch for the red flags that mean you're losing. Check your wound every few hours. It should gradually look better. Less red, less swollen, less painful. If it's getting worse, more red, more swollen, hot to the touch, that's infection setting in. If you see red streaks extending from the wound up your limb, that's lymphangitis. The infection is spreading through your lymphatic system. Check your temperature if you have a thermometer. Anything over 101 degrees Fahrenheit is a fever. Over 103 is serious. If you're shivering uncontrollably despite being covered in blankets, that's rigors, sign of severe infection. If you're confused, can't think straight, that's altered mental status. Your brain isn't getting enough oxygen. Any of these signs mean you need to increase your garlic intake, increase your honey applications, stay hydrated, and hope your immune system is strong enough to win. Here's the truth they don't tell you in the movies. Surviving a gunshot wound without medical care is possible, but it's not guaranteed and it's not pretty. You're going to have a scar, probably a big one. You might have permanent nerve damage. The limb might not work quite right ever again, but you'll be alive.
And in a world where 911 doesn't exist anymore, alive is the only stat that matters. Pressure, tourniquet if needed, clean and pack, antibiotics or substitutes, pain management, infection monitoring. That's your playbook. The bullet hit you. You bled. You didn't panic. You did the work. And now, you're still here. The wound is packed. The bleeding stopped hours ago. Tomorrow, you'll check it again. Every day you wake up is a day you won. That hole in your leg? It's just proof you're tougher than metal. Now keep that wound clean, keep your head clear, and keep breathing. You've got a world to survive in, and you just proved you can do it.